Myself, Dr. VAIBHAV DHARAP. I am a consulting physician, diabetologist and nephrologist practicing at Mahat District, Raigad at V-Care Nursing Home and Nephron Dialysis Center. Today I will give you a brief idea about diabetes and its complications. So when do we call a patient diabetic? Diabetes is a syndrome when the sugar levels are high in the blood. So the fasting blood sugar levels are normally between 100 to 120, and postprandial, that is after meals, the sugar level has to be up to 180 milligram per day. So when these levels go beyond their normal limits, we call it as diabetes. The HbA1c, which is a 3 monthly average blood sugar level, goes more than 7%, and then we label it as a diabetic person. So what are the complications of diabetes? First comes diabetic retinopathy, which is related to the eye. In this, the blood vessels in the eye or the retina, they get damaged. Slowly the leakage starts in the retina and patient experiences diminished vision, which eventually leads to complete loss of vision. So getting your eye checked once a year is compulsory in every diabetic patients to avoid the loss of vision, because the symptoms arise very late, and hence if you get your eye checked regularly, you can halt and you can detect the diabetic retinopathy at an early stage and help prevent it. The second complication is diabetic neuropathy, in which the small and large nerves of the body, the patient experiences burning sensation of palm and sole. He also experiences tingling and numbness of the feet, because of which the small wounds go undetected and eventually turn into large non-healing diabetic ulcers. So wearing footwear even at home is necessary to help prevent such wounds, and the incidence of diabetic ulcers can also go down when you keep checking your sole at home regularly. The third is a fatal complication, which is diabetic nephropathy, in which the kidneys start leaking protein at a sustainable rate and develop into microalbuminuria. Microalbuminuria is excretion of protein up to 300 milligram in 24 hours, while macroalbuminuria is more than 300 milligrams. So when the patient reaches macroalbuminuria stage, it is very difficult to control the rate of progression of chronic kidney disease. So early detection in the microalbuminuria stage is very important, and when the protein leakage is detected up to microalbuminuria, your physician or diabetologist will change your drugs, and it will help to decrease the progression of the chronic kidney disease. Hence, getting creatinine and urine routine checked at regular intervals is necessary. Get your creatinine checked at 3 monthly intervals and urine routine at least once a year for diabetic patients. The other complications are increased incidence of stroke, CVAs, then increased incidence of myocardial infarction, sudden cardiac arrest and sudden cardiac deaths. Then there is diabetic autonomic neuropathy, diabetic gastropathy, and some skin diseases. These are also less well-known complications of diabetes. So, considering all these complications, diabetes is a very fatal disease, and hence one should keep their lifestyle healthy. They should have control on their diet, regular exercise, and keep your oral medications and regular visits with your doctor to keep your sugar levels in control and hence prevent the complications. For next update and more information about diabetes, we will meet you in the next video. Thank you.